Hi, I'm Brittany. I'll be your student nurse practitioner today. May I get your name?
Valerie.
Hi, Valerie. So today you're just coming in and we're going to do your annual head to toe assessment. Okay, so we're just going to start from the top, working our way down. I'm going to look at your head, your eyes, nose, mouth, ears. I'm going to listen to your heart and your lungs, as well as listen to your abdomen. Okay, and then I'll also be testing your strength and your range of motion, as well as doing an eye exam and then testing your cranial nerves. Okay. All right, so first things first, I'm gonna start by looking at your head, okay? So I'm just checking the symmetry of your head, making sure there's no lesions, no masses, or anything like that, okay? Now, I'm gonna be looking at your neck, making sure there's no lesions, no masses. I am also, while I'm looking at your neck, I'm checking your thyroid as well as checking your carotid. And then also, I'm going to be looking at your trachea just to make sure that it's midline. Can you swallow for me? All right. So, and no jugular vein distension noted. Lean your neck towards the side for me. Okay. Other side for me. Thank you. All right. And now I'm going to palpate the skull, cheeks, chin. Any tenderness in the nose. Okay. Now I'm going to look in your eyes, okay? Just look straight ahead at me. Okay. Now I'm going to test your 6 cardinal gaze, okay? So you're going to see me come in from each side. And what I'm doing is I'm just looking at your pupils, okay? Okay, now I'm going to be assessing your lymph nodes, okay? I'm going to start here at the temporal. And we're going to go behind your ear. The occipital behind the neck. Submandible. Submental under your chin. Superficial. Deep. And then your posterior. Okay. Alrighty. Now, because you are a little bit taller than me, I'm just going to ask you to turn this way so that I can assess your thyroid. So I'm going to come in from the side like this. Look up. Okay. Can you swallow for me? All right. And all right, now I'm just going to be looking in your nose, okay? So just look up for me so I can look in your nose. Okay. It's pink, no deviated septum. Septum seems to be intact, no discharge, no mucus. Okay. Now I'm just going to look at your lips. All right. Now open up and say ah for me. Ah. Okay. I do see your uvula. It is midline. All right. Teeth are intact and in good condition. All right. Mucous membrane in the mouth is moist, soft. Okay. So go like this for me. Stick your tongue out, up, down, side, side. So right now I am looking at cranial nerve number 12. When you stick your tongue out side to side, up and down. And then can you say light, bright, dynamite?
Light, bright, dynamite.
Okay, so cranial nerve number 12 is working. All right, next I'm going to look in your ears. I'm going to be checking for symmetry, looking for any lesions, any swelling, any tenderness or drainage, okay? So since she's an adult, we do pull the ear up and back. No drainage, no swelling, any tenderness in the ear? Okay. Look in this ear, up and back. And then when I'm also looking in your ear, I'm looking at your eardrum as well. We look for what is called a cone of light, just to make sure that the eardrum is intact, okay? As well as when I was looking at your eyes, I didn't see any redness, any drainage or puffiness. And your visual acuity seems to be good. Are you able to see this chart right here, this vision chart?
I can't see the last line, but I can see like
Which is the smallest line that you can read?
the ORDHJ.
Okay. Now what we're going to do is we're going to test her cranial nerves. So we're going to start off with cranial nerve 1, which is going to be your sense of smell, okay? So I just want you to tell me, what does this smell like to you?
Like alcohol.
Okay, correct. So your sense of smell is working. Okay. Cranial nerve number 2 tests your visual acuity. So I had you read something far. Excuse me, now I want you to read something up close.
The whole thing?
Any line that you can see up close.
LTFPH.
Okay. So cranial nerve number 2 is intact. Cranial nerve number 3, and that was when I checked your pupils for Perla, and that was intact, so that one is working. Cranial nerves 3, 4, and 6 are in control of eye movement. So when I had you follow my light, I was looking at your cranial nerves as well as your eye movement, okay? So cranial nerve number 5 test is called your trigeminal nerve. And what this one is motor and sensory, okay? So what I'm going to do now is you're going to feel, I want you to close your eyes, and then I want you to tell me what part of your face I am touching, okay?
My forehead. My chin. My cheek.
Okay. So your trigeminal nerve is intact, okay? Number 7, cranial nerve number 7 is going to be your facial nerve. So can you smile for me? Can you frown? Can you puff out your cheeks? Good. All right. Cranial nerve number 8, that is your acoustic nerve. So that's in charge of your hearing. I don't have a Weber or a Rhine tool, but what I can do is the Romber test, okay? So what that is you're going to stand up for me, and you're just going to close your eyes. And now I'm just observing to see if she's swaying back and forth, if her gait moves. This would let me know that there is an auditory issue or an imbalance. But there's no swaying, so she's good. You can go ahead and have a seat. Cranial nerves 9 and 10 are the glossopharyngeal and the vagus nerve. So I looked at the glossopharyngeal when I was looking at your uvula. I looked at that, it's midline, and there's no buildup of saliva, so your cranial nerve 9 and 10 is working. 10 is your vagus nerve, of course that's the nerve when we bear down to go to the bathroom. And then we looked at cranial nerve number 12, that's when I had you stick out your tongue and say light bright dynamite. So good, all your cranial nerves are working. So now what we're going to do is we're going to do her upper and lower extremity range of motion. We're going to be testing abduction and adduction. We're going to look at external and internal rotation, as well as your strength against resistance. Okay? All right. So first things first, are you able to raise your arms up like this? Any pain? Bring your arms back down.
A bit in the shoulder.
A bit in the shoulder. Okay. Are you able to put your arms behind your head? So this is testing external rotation. Are you able to put your arms behind your back? This is testing your internal rotation. Okay, good. Now, what I want you to do is I want you to put your arms out again like that. Now I want you to try to raise your arms. Good. All right, now I want you to try to lower your arms. Good, okay. So she did show strength against resistance in her upper extremities. So now we're gonna look at your wrists and your elbows, okay? Are you able to do this with your wrists and elbows? Okay, so I want you to push against me. All right, now I'm gonna push against you. Good job. So she was able to show strength against resistance in her arms and elbows, okay? Now we're gonna do the same thing with your legs. Are you able to bend and extend the right leg? Good job. Okay. Now I want you to push against my leg, push against my hand. Good. Now push against it again. Good. Now, with your foot, I want you to push against my legs, my hand. Good. Okay, so she is showing good range of motion in that right leg, as well as she has good strength against resistance in that right leg. Okay, so now for your heart, first thing I'm doing is I'm just observing your chest, making sure that it's symmetrical, okay? I looked at your carotid and I looked at your jugular already. What I am going to do is I am going to listen for what's called a bruit, and what that is that's any turbulent blood flow, which means that there could be an issue, okay? Okay, so no bruit was heard over the carotid. Okay, and so now I'm also going to palpate for a thrill, which is also the bruit. So I'm just checking to make sure that there is no turbulent blood flow, okay? So we did the temporal, we looked at your carotid. Now what I'm gonna do is I'm checking all your pulses, okay? Radial. Popliteal. Okay, and then can you take your shoe off for me? You do have some pedal pulses in your foot. All right, so we checked the temporal, the carotid, the apical, brachial, radial, ulnar, femoral, and popliteal pulses. Next, what we're going to do is I'm going to listen to your carotid, your aortic, pulmonic, Erb's point, tricuspid, and mitral valve, okay? I know that's a lot, but it's only 5 places that I need to listen to, okay? Are you okay lifting up your shirt? Oh. Okay. So at the top, when we listen to the aortic, you hear the S1, which is the dub, and you hear it louder because the heart is actually upside down in your body. Yes. So since your heart's upside down, at the aortic point, you'll hear that S2. At the pulmonic point, you'll hear an S2, and at the Erb's point, right in the middle, you'll hear an S1 and an S2. So your heart sounds were all normal. Okay, and so now I'm going to listen to your lungs, okay? So when I look at you for your lungs, I again look for symmetry. I make sure that when you breathe that your chest rises symmetrical on expansion, your chest rises, okay? And that you don't have any shortness of breath, okay? And then also I'm looking for crepitus, which is gonna be a little crackling. So when I go like this or palpate on the back, if I hear any crackling, that's kind of air in between these little pockets. Okay. So no crepitus, so you're good. Okay. All right, so now I'm gonna listen, and then if you can go ahead and raise your shirt for me again. And we'll do the back. So just take nice deep breaths for me. Okay, now what I'm also gonna do is it's called percussing, and what I'm doing is I'm just tapping, okay? And what I should hear is I should hear a dullness or a hollow sound, and that means your organs are fine back here, okay? So raise your shirt for me. Okay, so what now I'm doing is I do the dullness over the diaphragm. Okay, so thank you for that. And all right, so next what we're gonna do is we're gonna be looking at your abdomen. So what I'm doing is I'm just looking at your belly to make sure that it's not concaved or too round. Okay, and then what I'll be doing is I'm gonna listen to all 4 quadrants of your belly just to make sure that your bowel sounds are active. And I'm also gonna listen to your abdominal aorta, which is right here. And then I'm gonna percuss, and I should be hearing hollow sounds over your appendix, liver, spleen, and colon, okay? And then finally, what I'm gonna do is I'll palpate, which means I'm just gonna press on it, okay? So your stomach looks normal, it's not concaved, and it's not too round. So now what I'm gonna do is I'm gonna listen, okay? Mm-hmm. Okay, now I'm going to listen to your abdominal aorta. Okay, so bowel sounds are active in all 4 quadrants. Okay. And then, so right here at your lower right, this is your appendix. Upper right, this is your liver, and you just tell me if any tenderness, okay? Upper left, I'm now feeling the stomach and the spleen. And then lower left, this is the colon. Any tenderness? Okay, perfect. So no rigidness, no tenderness. Okay, now I'm going to test for your gallstone, okay? So what I'm going to do is I'm going to push down kind of hard, and you're going to take a big deep breath in. And if you have any trouble taking that deep breath in, you just let me know, okay? All right, take a deep breath. Any trouble? All right. So if you were to have any problems with your gallbladder, you would have had some pain when you tried to take that deep breath in while I was pushing on your stomach, okay? Now I'm going to check your appendix. So if you did have any problems with your appendix, you'd have what's called referred pain. So I'm going to push down on this left side. Any pain on the right side? Okay, good. Now, so turn around to the back for me. We're going to do what's called CVA. I'm looking for kidney pain or kidney tenderness, okay? And this goes with, I'm going to use indirect percussion right down here in your right lower quadrant. I'm just looking for any issues with her kidneys, okay? Any pain? Any tenderness? Okay, so no kidney pain, no kidney issues going on. That's good. Alrighty, thank you.